good so you can crush it in your goals for sport, gym, and life. This is a really good group here tonight. I wanted 12. We had 3 people that had to drop out. And why this is a good group with all you beautiful people is that this is supposed to be interactive, right? So hopefully we can get some conversation started about, not interactive, I'm not going to make you do anything crazy, don't worry, but I would like to get some conversations going so I have a better idea of where people are coming from with their different situations. So this is a really good sized group. So I appreciate everybody being here. New faces, current faces, old faces, maybe some return faces. So thank you very much for being here. If you don't know, my name is Dr. Eric Wallace, and I am the owner here at Motus Rx, and we have been in business. It'll actually have been 9 years in this February, so that's kind of hard to believe. And we work with a lot of active individuals. We help them move confidently and feel resilient, and oftentimes get back to the things that they love doing, which is a lot of times high level stuff. So that's our MO, is to help people really transform from a pain and a broken and a down state to getting back to being ultimately really strong, resilient, and even better than when they came in for pain. So the goals for tonight. First, I want to make sure that we get a good background from a few people who have been working with us and showcase them and help them tell their story a little bit so that people get a better sense of how we operate here. I can sit here and talk till I'm blue in the face about how we operate and what we do, but I'm obviously biased and I like myself a lot. So I'm not gonna have a hard time. I'm not gonna have a hard time talking about that, but it's nice to hear from people that have been through the process. And if possible, if you are new or returning and you get the chance to talk to these people afterwards, I do highly recommend it, and just sharing your experiences a little bit. I also want to talk a lot about debunking myths and misconceptions with back pain, because unfortunately there are a lot of them. And unfortunately a lot of them come from what we were taught to believe is the highest level of medicine, which is our medical field. And oftentimes, unfortunately, our research is showing more and more that it's not the way it goes. So we're going to talk a little bit about that. And then I'm going to tell you about our system here, our 3-step process about how we help people go from pain and anxiety about what's happening to ultimately transformation and resilience. So who here has back pain currently? Good subject test for later, good subject test for later, good subject test for later. Who here has had back pain in the past? Okay, so I think everybody's in the right place. Everybody's in the right place. So that's going to be a big emphasis tonight. I want to get a little bit interactive and just try a couple things. The goal for tonight, and I apologize if that's what you're here for, is not for me to sit up here and blabber about anatomy and talk to you about L5 discs and arthritis and all these big fancy scary words that you might see in an MRI report or something like that. I'm certainly happy to answer questions about that and talk about it afterwards as well. But I really want to get more into the why and the background of all of this. Okay, so first question. Somebody's got to volunteer first. What is something that you have tried for your back pain? Mike. Surgery. Okay, thank you.
L4, L5.
Okay. Okay. Anybody else? Eat. Very common. Chiropractor. Very common. Good. Okay. So I'm going to talk to you a little bit about my aha moments. And back pain is personal for me on 2 levels. The first is a story about a sweet old lady named Sue. We'll call her Sue. But I was 6 months, I think 6 months probably roughly there into my youth PT career. I was in an outpatient orthopedic facility in a hospital-based setting, and we kind of saw a little bit of everything, and it was a really great opportunity for me to get my feet wet and see a little bit of everything when I was just starting out. But I had this sweet old lady named Sue on my schedule who came in for back pain, and her back pain was, pretty traditional, like a lot of what we'll see, mechanical, nothing, debilitating, but annoying enough to be seen. And Sue was what I would call a rapid responder. So something that should have taken about 10, 12, 16 visits to get better took for Sue about 6. And at that time, I was in an insurance-based model, so Sue could get off the couch and she could wipe her butt, and so she was discharged because that's what the insurance said she needed to be able to do. So I said, great, you're good to go. Sue, been a pleasure working with you. Hopefully we don't have to see you again. About 6 months later, I'm now a year into it. I'm like the best therapist there ever is, right? I'm just feeling really good about myself. And I see Sue on the schedule again, and I'm like, because I am so good, it's got to be for something else. It's going to be her shoulder or her knee or something like that. And unfortunately, it was her back again. So usually when I have a repeat offender like that, I had a professor once who had a really good comment about, let them tell you what's going on, because if you listen to them hard enough or long enough, they will tell you what's going on, and you'll get the answer just from what they're telling you. So in that case, and I still do this to this day, I looked at Sue and I said, Sue, you're back here for back pain again. What do you think is happening? What do you think is happening with your body? And she looked at me very sternly and said, you're the expert. That's why I'm here, and you're going to figure it out. So I wasn't all that I thought I was at the time, a year into it. And that has stuck with me because as I was talking to somebody earlier, we don't love seeing people back for the same thing. That would make me feel like a crummy practitioner. If you want to come back for proactivity and maintenance and staying ahead and all the wellness things, great. But to come back because you feel like you have to because your situation regressed is not our goal. So that has stuck with me. And then my personal back pain story is somebody in the crowd. We run a workout every Tuesday, Thursday, Saturday here. And her husband does an awesome job running all the programming and whatnot. But we were here on a Saturday morning. Might have had a little fun on the Friday night before, might have not slept the best. And I go into the workout. And on Saturdays, we do the bike for a little while, and then we get off and we do a bunch of strength stations. And one of the stations was a deadlift. And it wasn't very heavy. It was 95 pounds or something like that. And so you do 40 seconds on, 20 seconds off, you switch stations. And it's the third time through, and I'm like 10 seconds left in my station. I'm just cranking these deadlifts out because you got to do as many reps as possible, right? And I'm on the way up, and I feel something pop in my back. And first I drop the weight, and then I kind of freeze a little bit. And mind you, we're in here, right? And I freeze up a little bit. I kind of waddle over to the table. And by the time I get over to the table, I'm feeling nauseous and like I'm about to pass out because the pain is that bad. And I hadn't ever really felt anything like that, thankfully, at least in my back. And so I'm like, oh, guys, keep going. I'll be fine. I'm good to go. Just let me lay down for a moment over here. So everybody kind of keeps cranking, and I'm over here trying to, figure out what to do next. And that's the point where, if anybody has been there, you go to some pretty dark places, right? So in that moment, you start saying, I might not be able to work again, right? I might not be able to keep this business going. I might not be able to play with my kids. And it's ridiculous when it's all said and done, but that's where you go immediately. Is the worst case scenario is how bad is this going to be, and is it ever going to get better, and what the heck is going on here? So from that time, I have a lot greater idea of what the people I work with. I've always had an idea of what people go through physically and kind of how to help them with that. But the mental side of this is what's really crazy, is just the darkness and the loneliness that comes with some of this stuff. And thankfully, I knew enough what to do to get out of it. And now my goal is not having it come back again, like I said before. So those are kind of my two big aha moments that will, continue to push me forward in how we treat back pain and how we look at it, and the individuals that we work with. Okay. So I think before we move forward on what to do and what we do here, cameraman wants me to move this way. We are live streaming for people that couldn't be here, by the way. That's why the camera's running. So So I think it's important to talk about what not to do. And because I think when you say, that's why I asked the question before, what have you tried for back pain? There is a lot. There is a lot. If you were to Google what to do for back pain, there's going to be a lot of different stuff coming up. But I think you can be very, very certain that in my now 16 years of treating back pain, I think there's one mistake that I see very, very commonly happen. And unless you're probably 1 out of 20 people, and unfortunately, based on conversations I've had with people already, there might be a couple of these 1 out of 20 in here. But 19 out of 20 people, they don't need to go down this route. And I would beg you to not treat back pain as a medical problem. All right. And what I mean by that is think about what most people would do if they had a back problem. They would treat it like an ear infection or a sore throat or potentially a cancerous issue or potentially cardiovascular issue. They would go see their primary doctor. And you guys can raise your hand if this sounds familiar. They would say, okay, I'm going to put you on some muscle relaxers or some painkillers or anti-inflammatories. And I want you to rest for 2 or 3 weeks. And then if it's not doing any better, give me a call and come back. Well, what happens there is some people get better, right? And their pain was resolved, but there was nothing that happened to address the underlying issue. They just got out of pain and on they go with their life. So that's okay because they're not feeling pain, but it's not ideal because those are the individuals where it's very, very likely to happen again. The other thing that happens in that time frame is if they don't get better, they go back to their physician and there's 2 problems. One, they've now had 2 or 3 weeks of complete deconditioning, which I'll talk about in a little while when it comes to pain. But they've also go down the next rabbit hole of obviously the doctor's going to say, well, we need to do an X-ray or an MRI. If you are my age, maybe probably I would even argue some of the research says 25 and above, and you get imaging of your spine, they're going to find something. They're going to find arthritis. They're going to find bulges. They're going to find something scary. And the problem is that our research is really strong that what shows up on an X-ray and MRI does not automatically correlate to pain. So sometimes we're going down the wrong rabbit hole, which is also a big problem. But realistically, those people would get X-rays, MRIs, might be injections to follow, might be surgery. I beg people that can still happen, and that does have to happen for certain people. But I would beg anybody, and hopefully people can do some preaching after tonight, is try the conservative route first and see if there's not something that you can do to manage it without having to go down that rabbit hole. And realistically, why a lot of this doesn't work anyways is whether they're doing medications, injections, surgeries. One of the problems is that while they're well-meaning, they're going to be in a situation where they're treating the symptom instead of treating the cause. Okay, so if it's a disc, if it's arthritis, if it's a pulled whatever, a lot of those strategies revolve around treating the symptom, not the underlying cause. You can do both, right? You can, we'll talk about in a second, you can put the fire out, but then what are we doing to make sure we understand why it happened in the first place and that it's not going to happen again? All right. The real problem in these cases, like I just said, is that we didn't get to the root cause, right? We went down chasing a symptom rabbit hole, but we didn't identify why that happened in the first place. And then here's the other real problem. A lot of soapboxes tonight, I apologize. A lot of us don't have a good awareness of what house we're living in. And what I mean by that is our bodies. If we have a house, and again, the analogy is the body. If we have a house that's messy, chaotic, loud, stressful, always on high alert, in the body's case, that would be poor sleep, poor nutrition, poor recovery strategies, not good relationship, social situations, not doing something that we're passionate about, even how I feel about the situation. Am I going to get out of this or am I doomed for life? That basically automatically puts you in a spot where you're more likely to have a painful experience. So if I am going to go hiking 5 miles up a mountain and my knees hurt, there's going to be normal tissue breakdown that I get a little soreness from that. But if I'm living in a house where everything is not really well oiled, I'm more likely to have a painful experience even with the same stimulus, as somebody else who has a good system. There's not a lot of inflammation. They're doing all the right things. So this is another real problem, is that we're very quick to not talk about those things. In the medical system, we don't talk about the other buckets of health, like how's your nutrition, how's your sleep, how's your recovery, what are you doing for fun, what are your relationships like, all that good stuff. And I will go to my grave that some of those things are probably way more important than even what I can do for somebody. If more people slept, I'd have half the people that I do. I'm convinced of it. So that's the other real problem that we get the luxury in here of talking to people about, because we can spend time, and obviously we can look at more just treating symptoms. Any questions about any of that? Or what question do you have about any of that? Anybody feel like they've been down the rabbit hole before with the medical? That's good. That's good. I like to hear that. Okay, our 3-step formula for progress, and this is pretty generalized, but I like to just put it so it makes some sense simplistically. I talked about putting the fire out. So when somebody comes in and they have pain, I don't just say, hey, let's go pick up the barbell. We're going to deadlift 300 pounds now, okay? And I don't say we're going to exercise through this, or we're going to stretch through this, or I'm going to, pain educate you out of this. We have to do something to reset, restore the nervous system, calm things down, reduce inflammation, whatever that might be. So we do treat symptoms, don't get me wrong, but we don't stop there, which is what happens at a lot of places. Then we talked about finding the true root source of the problem. So in a little bit here, I'll talk a little bit more about a couple examples of what I'm talking about with how do we identify where the problem is truly coming from. And then the third one, which comes back to prevention of reoccurrence and not having things happen again, is what I call building a bigger cup. So there's a little bit of an analogy that I like to use where all those things I talked about before, lack of stress, lack of sleep, poor nutrition, hydration, all that stuff. Anytime you have that and you think about how you're the cup, you add water or whatever your drink of choice is into that cup. When that cup overflows is likely when we have a pain experience. So what we're trying to do for people is we're trying to build a bigger cup. You can do that through better sleep, like I said, better nutrition. But one of the big ones for a lot of the individuals I work with is just pure physiological strength and how they can handle the stresses that their body takes on. So once somebody is out of pain and we understand why, then it's just full speed ahead about building a bigger cup. So step one, putting out the fire. Pain is bad. It's really bad. It's actually a great design by the body, but it's really, really bad. And it's not bad just because it hurts. It's not fun. It puts us in a very different emotional state than we prefer to be. It can be very frustrating and infuriating. But physiologically, the other reason why it's bad is that there's something that happens is we get automatic inhibition of our muscles. So the easiest example I have is if I hurt my knee, my brain knows almost unconsciously, without me knowing it, I need to stop using the quad as much. I need to stop using my hip as much because of that pain. And so why that's bad is if you think about the advice before of go rest, go home and rest for 2 or 3 weeks and come back and tell me if it's better. In those 2 or 3 weeks, you've deconditioned unbelievably more than you could even imagine just in that time frame, because the body's already creating inhibition and shutting the muscles down without you knowing it to protect you. The short term, it's a great compensation. Long term, it's really, really bad, because when you go back to do the same activity now, it's not going to be the same. Now you're 3 steps behind where you were, even if you're pain-free. What we do for putting out the fire here, anybody have social media, Instagram, Facebook, TikTok, right? You're going to see stuff all over the place, right? Dry needling's a popular trend right now, cupping. You see a lot of people that they put the mic on and bam, they give the big crack and it sounds awesome. The chiropractor they just love it. point being, we can do any of that. We do whatever it takes to help the individual. Some people love dry needling, and I have to tell them to stop coming for dry needling because they're so addicted to it. Other people despise it and don't want anything to do with needles. So some people, we use it, some people we don't. But that's a conversation that we have, between us as a team, and we really come up with a plan that's going to help calm the nervous system down, not make you miserable or sore or scary or anxiety. And we really do whatever it takes to put the fire out and restore the nervous system. Now, this is probably my favorite slide out of any of them tonight, other than when our health heroes come up later. Finding the true root cause. So why treating symptoms for right where they're at, whether it's back, knee, shoulder, elbow, why it's just common sense to me now, after knowing what I know, it doesn't make sense, is that we do not move in isolation. So if you bend your elbow, your shoulder's working. If I bend my lower back, my hips are working, my hamstrings are working. Realistically, what we do is we move in patterns or we move in synergies. So your body has portions of it that work as a team, and we call those synergies or lines. And so we have to understand if those movement patterns are efficient or not. If the person has pain or they don't have pain, we still have to know if those movement patterns are appropriate and efficient. Because if they're not, so if I'm a runner and I step with my right and I march with my left, that's a pattern. I'm not just flexing my right glute, I'm flexing my left hip, I'm engaging my core. Any alteration in the movement patterns creates breakdown in some tissue. So that's where if I see somebody that's got a hip weakness, they could have pain that goes in their knee, they could have pain in their actual hip, they could have pain in their back. And it's likely because of how it's affecting their movement pattern is creating an inefficiency at one of those spots and breakdown there. So that's a really, really large part of our evaluation, is figuring out how people move. And then also, this is a really good quote. Unfortunately, I don't know. I think I got it from one of my continuing education places, but you didn't get hurt on a table, hopefully. And you won't get all the way back on a table either. So the thought of spending 95% of your session and you're on session 16 and you're still getting table time and that's all you do and you don't progress anything, you don't look at movement patterns, you don't look at strength. If that's still happening, and especially if you're not progressing, I highly recommend getting out the front door as soon as possible. Because at some point you have to build back up and you have to re-educate those movement patterns. Okay, so I've been talking a lot. I wanted you guys to talk more. I get it. You're nervous. I like myself. Again, I like to listen to myself talk. So let's do a little group project time. I'm going to do one test just to kind of explain this and get a better sense for what I'm talking about. And I'll do it kind of in front of everybody. And then anybody that wants to, I just put out different mats. We got the table. You can try a couple of these things and just get a little sense of what I'm talking about. So who has one-sided back pain? Anybody have one-sided back pain? You? Justin, what do you have? General? Both? One-sided? Heidi? Okay. You mind? Can I test you? Okay, come on up. Block nothing. I'll stay over here. Okay, what side is your pain on again? It's on the right. Okay. So what I'm going to test a lot of times with a one-sided back pain, and she was not paid. We're in a plan right now, so maybe this is better than I think it will be. But she was not paid to do bad or good or however on this. But your pain is on your right side. So what we want to do is we want to see the lateral line or the lateral synergy, which is how the entire right side of her body works together. Okay, so glute, side body, lat. Again, I'm not going to talk anatomy tonight, but there is a lot of patterns in life where the whole right side needs to work as a team. And there's a test that I do quite frequently to figure this out. So I didn't even have you stand with your feet shoulder width. Face the masses here. All right, so your pain is on your right side, and where specifically, typically? Okay, so what I'm gonna have you do is just hang with your arms at your side, relaxed. Okay, any wrist or hand problems? Okay, I'm gonna try to give you a big pull here. Don't let me move you. Okay, am I pulling hard? Okay, you almost lifted me off my seat. and I'm like twice the size of you. So that's a good clean test. All right. Now, same thing on this side. Okay. Am I pulling the same?
Yeah.
Okay. So her pain is on her right side, right? And that would be a test for basically the strength stability of her right lateral line. Now, there's a lot of reasons why this can happen, right? I'm not going to be able to sit here and say, Heidi, you have blah, 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 L4, L5, and this one. But we need to evaluate that farther, because that's what's happening in everyday life for her. She's carrying weights at the gym. She's doing different weights at the gym. She's doing something single leg. She's doing something double leg. That, thank you very much. That inefficiency will create breakdown. I can't say right now, again, I'm not playing the mentalist or whatever the people are that can see the future. But we have to identify that, because her pain's on her right side. That right side is not doing its job very efficiently. And whatever she's doing in real life has the potential to create breakdown on that right side, okay? So let's try this as well. Everybody that wants to try these, let's try a couple other ones. So everybody that wants to try these, I'll demonstrate on the table here. Let's look at the posterior oblique, which is this fancy way of saying my right backside here and my left upside here. One of the ways you can test how that's working. Now, this would be really, really important for walking, running, single leg sports, any side-to-side movements. So a lot, be important for a lot. But what you're going to do is you're going to go feet together. You're going to bring your hands together towards the sky, so I can't really cheat through my arms. You're going to push down through your feet. And then from here, I'm just going to kick one leg straight out. And I'm going to try to see if I can have stability through the hips without my pelvis turning and dropping this way, or without the pelvis kind of dropping all the way down, okay? And then what you would do is obviously want to test both sides. Oh boy, okay. So give it a shot if you want. Just give yourself a little self-assessment. Take a little time. I need a little intermission here anyway. So give it a shot. Try a little single leg glute bridge test and test that backside synergy. And if you've been working with me for a while, you better not fail anything. So one thing I'll typically tell people with this is not just how do you do, like, you know, does the hip drop or rotate, but how does it feel? Because my right butt cheek cramped and way too soon than it should have on that. So it could be like a cramp in your hamstring, which wouldn't be great. That'd be inefficiency. You could feel your lower back really tight and stiffen up. The other one that we'll do that we use a lot, and any yogis or people that are used to that, you've probably seen this move more for the front side, is these tables are soft. So opposite arm and leg comes out, right? Lock that in place, and then try to touch your elbow to your knee underneath and come back out. And again, that's going to be a little bit more of a test for the front kind of diagonal of the body. So give that a shot and see if you can do that again, because it was so impressive. So opposite arm and leg out. See if you demonstrate control there. Try to touch the elbow underneath and then come back out. And again, that's, oh boy, jeez. I got a sport coat on. Okay. Okay. Really? And my right side's not good. So just some small examples, right? These are the types of things where we would kind of go through a series of movement tests, and these are not end-all be-alls, but they do kind of start to guide us in a direction of what do we need to do next. Now, like in Heidi's case, we might need to go and focus more on something specific, like an oblique or like a glute. Again, I'm not saying we never isolate and don't do any individualized muscle training, but we have the information now that we need to go in the right direction. Okay. So there's a couple other tests, I mean, a lot of other tests we do, but these are just some of the examples of when somebody struggles with this, we can start to say, okay, that's different. We want to analyze why, and we put the microscope on why. Okay. Thank you. Good. Glad everybody moved. Did anybody have any like really, really obvious differences there? It's okay. I'm not going to ask you to do anything more. I'm just curious. No? Everybody's just crushing it. All right. All right. And then, like I talked about, building a bigger cup. So this is pretty straightforward. We don't overcomplicate this. Once we're out of pain and once we feel like some of the previous things we talked about are addressed, now we go into kind of like fast break mode in terms of let's take all this goodness and really layer even more goodness on top of it. So we restore confidence and resilience a lot of ways in here by improving people's mobility, improving their strength, improving their power and speed, which anybody that is 45, 50 and above and they're not jumping or leaving the ground, that's a problem. You will pay for that later in life, unfortunately. So power and speed and some of those things still need to happen in our program because we want you to be able to handle everything that life's going to throw at you. We don't overcomplicate this, like I said, and how we don't overcomplicate it is something called graded exposure. So if somebody's goal is to pick their grandchild up off the ground again, I don't just put them on a barbell and have them deadlift right away. We work up to that. And each step is kind of a litmus test to get to the next step. So we push them maybe a little bit into where they need to go and maybe a little bit beyond, and then back off so that we don't overdo it. And each exercise or each new exercise, each progressed exercise is a test for the next step. Okay, a couple more bonus points to consider, and some of these are off of questions that I got from people ahead of time after they registered, and some of these are just things that I get a lot in here. So why stretching and foam rolling aren't enough? A common question that I'll ask people is, what have you done so far? If you're coming in for back pain, what have you done? Probably one of the most common answers I will get is I've stretched. I stretch all day. It feels amazing, but they're still in to see me, right? So there's a common misconception that the tightness of your muscles are a problem. Now, I'm not saying that the muscles don't feel tight, but why they feel tight is really, really important. And the truth is that tightness is a protection against weakness or a compensation point. So how many times do I have somebody say, oh, I got tight hamstrings? Okay, well, let me see you touch your toes. And their hands are flat on the floor, right? I can't do that, so I'm not going to. But you know, the reality is they feel tight, but they're not measuring tight. And in a lot of those cases, there's the strength aspect that needs to be looked at a little bit more. So this is the stretching relief frustration cycle that I'm going to trademark. I haven't done it yet, but I've heard this so many times in my life that I should, is the aspect of something feels tight and a little bit painful, so I stretch. I get relief. That's great. 2 days later, it's back. I stretch again. Feels better. Get relief. 2 days later, it's back. And it's the frustration of why isn't stretching it, helping? I feel like I'm really tight there. So this cycle can be broken by the appropriate strength training strategies and looking at some of these other things. Never, ever in a million years will I say that mobility or flexibility is not important. I'm just saying that, again, in 8 out of 10 people, they're often surprised that I'm telling them they're moving pretty darn good range of motion wise. They just don't have the oomph to handle what we're asking or what they're asking their body to do. And then I've covered this a little bit when I talked about what happens because of pain, but this is the other massive, massive mistake that we make is once we injure our back doing something, we stop, right? We stop not only the activity and we never go back to doing it again, but we stop anything that might somewhat resemble it. So for me, the deadlift in class, it's taken a while to really want to stand over the bar again and do that. So I'm not blaming anybody or saying that you shouldn't be concerned. But going back to our method and having that graded exposure, you can build up resilience and be adaptable and respond to progressive overloading. And that little SAID analogy down there is specific adaptation to imposed demand, which is just a fancy way of saying, if we push you just enough into your threshold and you get a little bit stronger, and you get a little bit stronger, and you get a little bit stronger, you will be back to doing that thing again, for sure. There's certain situations, again, surgical and otherwise, that I would completely understand that we would not be going all the way back to that. But there's a lot of cases where we get people back to doing the thing and doing it better than they were before, because now they understand what to do. And I just think, we have to have a little bit better mindset. It's my job and our job to help people have a little bit better mindset about what happens. You could have injured your back. How many males have I worked with that are 200 pounds and hurt their back carrying a lampshade stepping off of a curb? Right, a lot. So you could have hurt your back doing that. You could have hurt it deadlifting. It doesn't mean that deadlifting's terrible for you, never do it again. Doesn't mean that carrying a lampshade is terrible for you, never do it again. It just happens. It's a lot of the other stuff I was talking about with the what's going on with the body and all the inflammation and stuff like that as well. Okay, intermission time. Well, let's go questions about any of that. What question do you have? Hopefully a little bit better understanding of the why behind some of this and how we operate here. So, pretty good on time. Let's talk about our low back superheroes. All right, so I'm gonna take some time now to call up Mary Lou, Greg, and Crystal, and I'm gonna interview them. We're gonna talk a little bit about their process here and how far they've come. We're gonna do a little crowning and cape ceremony for our superheroes. All right, so I'll be right back. So you guys can come on up and take your spots. I'm gonna turn this mic on. Now's a good time to get a drink or hit the restroom or do whatever you need to do. Greg, I gave you the comfortable chair, sorry. All right, I have to go grab my. Yeah. Okay, so we do have a crowning and a caping ceremony for our superheroes.
I had nothing to do with the crown.
I figured gold and black was probably best for Greg here. So your kids will get a kick out of that. Kids might get a kick out of the cape here. I take back pain seriously. That's why I wore a sport coat. But we can still have some fun here, can't we? Go ahead and tie that on there for you, boss. All right, and then ladies, hopefully this is okay.
It's gonna be great.
Would you like to put that on?
Yes, please.
It is going to be great. It already is great because you're here.
You really weren't joking.
No. Why would I joke about? It's low back heroes.
Yeah.
You're a hero. I'll let you put that on however you want. Okay.
Thank you.
We will get our picture together too.
Oh, swell.
Do not let me forget. Do not let me forget. Okay. So I do genuinely appreciate you guys. Oh shoot, sorry. I do genuinely appreciate you guys taking the time out of your nights and sharing with us your experience a little bit. Hopefully I didn't put you on the spot too much. And tell us as much or as little as you want. And then I can chime in where I want to as well. So why this matters, again, I talked before about the loneliness that comes with back pain and the frustration. And I think, thankfully, I've seen a lot of success stories, not just because of me, but in general, that when I had it, I was pretty, other than the initial dark moment, I was pretty certain I was going to be fine. But sometimes if you're in it and you've tried a lot of different things and you're not getting success, you feel like it might not happen. So I think it's important to see hear other people's stories, and not that you're the same as everybody. Everybody's got a different situation, but I think it is important. So would we like to go any order here? I'll ask the question. I'll let you guys chime in. I don't have a dinger, a buzzer or anything, but just raise your hands. So first we're going to start with a little back pains or background. So what kind of back pain were you dealing with prior to working with us?
Miserable.
Okay. I have you on mic, so if you want to hold it.
Right.
Pass it
Okay.
on. Yep.
Very, very severe. Couldn't function at all. Couldn't get out of bed.
Did you do that?
I tried to get out of bed.
What did you do that?
Oh, so being that I had seen Eric done lower back classes and all, excuse me, this was on a Friday, I patiently waited for it to be 8 o'clock on Monday to call to come in for treatment. And went through a lot of treatment. All's good now.
Not paid.
Right.
I hurt my back actually a lot like Dr. Eric in the gym. So I was jumping off of a high box and just landed wrong, kind of tweaked it, and had some pretty substantial pain on the left side mainly. And I kind of at first tried to ignore it. I think that's basically how I always handled any kind of injuries in the past was, I'd take a couple of ibuprofen and pretend like it wasn't an issue until it wasn't an issue. Unfortunately, with the back, it really didn't ever get better with, ignoring it. It just kind of yelled louder. So I eventually came in here and he fixed me up pretty quick.
Really well said, but you were also voluntold by your wife.
That's true.
All right. Well, I was actually about 15 minutes into a hotel workout. And in my mind, I was thinking, oh, these weights aren't that heavy. I just wasn't really engaging or wasn't really thinking about it. I was doing kettlebell swing, and all of a sudden, after I did a few of them, and then all of a sudden I look over with who I was with, and I was like, I can't do this anymore. And I laid down for 45 minutes in a hotel workout. Oh, geez.
Sorry.
Small head.
It's not designed to fit.
So I had to lay down for the remainder of the workout. I had to get up, like pushing all awkwardly on my side to stand up. And then I had low back pain. I couldn't bend over. I had my husband putting my socks on. It was all the daily life tasks I couldn't do. So yeah, that's where the pain was.
Thank you. Yeah, that answers. I think everybody kind of answered how it was affecting. Had you tried other treatments before coming in with us? Crystal, you can keep it and circle back around.
I would say I tried the approach to rest and just pretend it was going to go away. It didn't work.
Ditto.
Oh.
Yeah, I've never really been much of a stretcher, of a, getting help for anything. I think I just mainly, fortunately for me, I'd been able to just recover without much treatment needed. But obviously this was a little different, and I recognized that pretty early on that it wasn't improving.
I went the route of doing stretches, trying some heat, trying some cold, and then thought about, I'd done like I said, the lower back classes. So tried to do them, which was extremely painful. And then just did lots of ibuprofen also.
Okay, did any of that work? Even temporarily.
Not really. Like maybe extra doses of ibuprofen helped, but nothing else really helped at all.
Okay, so what made you decide to eventually come in then? What was the breaking point or the last straw?
Well, basically, I wanted to be able to stand, sit, get dressed, move around the house, get back to activities and everything. And I knew that I would get help and everything, and I knew I couldn't do it by popping ibuprofen.
as Dr. Eric said, I was voluntold. After my wife saw me miserable walking around the house for a week, not being able to pick up the kids, not being able to do any of the household work, she pretty much had it and said, you need to sign or, call Motus and get on the schedule, because she was over it.
Oh yeah, so for me, just all the daily tasks I couldn't do, just all the things that you take for granted every day that you can do, I couldn't do anymore. And Dr. Eric has helped me multiple times with other things, such as plantar fasciitis, I don't know, just lots of things. So I have a nickname for him, the Miracle Worker. So every time I
Not
do have
paid.
something,
Not paid.
it's true though. I just knew that I was going to be able to get some relief. So I knew it was time to come in.
With the back, what part do you think made the biggest difference for you in our treatment?
I feel like it was just kind of all of it together. I feel like he said, you come in and you have a chat and you talk and you figure out, what direction to start. Then you do the movement screens. Every time I would leave, I would be able to move better the day like that day when I left. And just the exercises, we did do dry needling. Love, hate that. But yeah, and then the exercises at home and staying consistent with doing the exercises, I would say.
Yeah, important.
It is important.
Yeah, again, the exercises, I think consistency with that, I think was one of the biggest things that I saw. The exercises seemed very simple, very mundane, but they got the back moving. They kind of, it's the WD-40 for the back, just to keep it moving and kind of stretching. And little by little, it was, you get a little bit more flexibility, a little bit more range of motion. And yeah, it's just that consistency. Also, I agree, dry needling, love-hate relationship with that.
Ditto. I think very thorough conversations on where anything I tried at home, movement, again, dry needling, doing the very basic starting exercises and everything, and just really following the doctor's orders, and all makes a huge difference.
Question for you, please.
Yes.
Part of that, know your house, know your body.
Yep.
And you're listening still.
Yep.
Get them to play with the problem. How do you professionally not go about buying or getting too personal with what's going on sleep-wise, relationship-wise, kind of chaos are we dealing with?
Yeah.
We all know about, and I'm not saying this is the case with them, but
Yep.
psychosomatic stuff.
Yep.
Versus the real stuff going on. I know we test for that.
Mm-hmm.
How do you, in your exams, question without making somebody like me feel uncomfortable, because I might be going through a divorce?
Sure.
Or
Yep. It's a really good question. It's something I'm still working at. I mean, every situation is, I kind of go with the why. You ask why until you hit the roadblock, and somebody will ultimately stop and say, I don't really want to talk about it, or they'll continue on. So open-ended questions is really the best way. In my current experience is open-ended questions with no assumptions. Yeah, and people will not. And that's a really good question, because the thought about finding the root cause, that doesn't always happen on the first visit. A lot of times it doesn't, right? I mean, we try to get a guide from what people tell me and the movements on that first session, but it's really the current or ongoing questioning each appointment. I mean, we have longer appointments because the first 10-15 minutes are usually just talking, and people get more comfortable and the questions get better. And then also we use a test retest. So with the physical side of things, every time somebody comes in, I test them at the beginning, we do our intervention, I test them at the end. So it works both ways, where we kind of get more and more comfortable with the situation as we go forward. But yeah, the open-ended questions and not having any assumptions, because I mean, again, I hurt my back and God knows what I was doing that Friday night. I probably wouldn't tell some people in here, right? So, so that would be my answer. But it's a great question. That's a skill that we don't get taught in school. So you just keep working at it. Good question. Okay. I think people answered kind of when you started noticing real improvements. What can you do now that you couldn't before? What's the awesome ultimate outcome?
Well, first, basically being able to function with normal everyday tasks and all. And now I'm back to my walking, feeling comfortable with any challenges. I'm back at the gym, working out with the trainer. It's just being able to be me again and feeling the growth. First recouping everything I lost, not being able to do anything, and now far exceeding all of where I was when I first came in for that.
I think when I came in, you asked me, what my goal was, and my goal was I wanted to be able to go back to the gym and not think about my back during the workout. And I think I'm getting to that point now. I actually did just do yesterday. I did hurdle hops on the high bar for the first time since when I heard it, and that was definitely one of those, mental blocks that I had. Where you even told me last week, I think it was, where like you gave me that little extra gentle push to you got to push the limits a little bit and not be afraid to try it, because I physically was there, I just wasn't there mentally yet, and now I finally got over the hurdle.
Yeah, I would say going back to the workouts at Burn, and not shying away from doing some of the exercises that I was scared of before. I now can do the kettlebell swings. I'm just intentional. Why can't I say that word? Yeah, about sounded weird. I can now think about that as I'm doing the exercises, and then I just know that I'm doing them correctly. The technique is there, and I'm engaging the muscles that I'm supposed to be engaging now that I know what I should be thinking about. And also, I'm able to flip around at the gym, like I said.
Nice. Show off. All right. So I think to finish up, what's the biggest lesson you learned about your back pain recovery? What would you say to someone that might be skeptical about?
I would say listen to your body. Don't just wait and hope it gets better. If somebody is skeptical, I would say give it a try, because you never know what you would find out about your, let's say the movement screen or just talking. It's just kind of crazy what you find out, what's going on inside, and you wouldn't have thought it otherwise.
I think the biggest lesson I learned is just to stay consistent and listen to what the professionals are telling you with it, because it's not rocket science type movements, but it's the right movement for what you need, and that makes all the difference.
Thank you.
Again, ditto. If someone was hesitant, I would urge them to make the phone call, walk in here. Why procrastinate when you can get to your recovery sooner? And I learned, just pay attention to your body, listen to your professional, and do the exercises and all.
Exercises are good for you. Thank you. All right. I think we should give our heroes a big round of applause. Can I get a picture? Can I get a picture with these?
Oh,
Yeah.
put her across.
Cheers.
Your
Straighten
crown's
myself
up
up.
here.
Oh, I got my sport coat on. That's good enough for tonight.
Should I?
Come on in. Come on in. Yeah, come on in. Come on.
put one from-
Make sure you can see the crown and the crown and the. Thank you. Awesome. Give a round of applause. Actually, before you guys go, does anybody have any questions for them? Put them on the spot for me.
Still doing exercises.
Absolutely.
I will say I don't do the exercises as much as during recovery. I've been feeling pretty good, and I'm getting a lot of the.
So if you start feeling better, do you still do them?
Oh yeah.
Oh,
I
okay,
sti-
Okay.
so
Definitely.
so I with the workouts that we're doing in the gym, a lot of them crossover. If we're not doing something that's going to be hitting those muscle groups, then yeah, do the exercises instead.
That's a pretty common conversation that's had at the end, and a common question I get is, so am I going to need to do this for the rest of my life? And it depends on what the person's going back to, right? So if somebody's going back to a gym, hopefully, presumably, they're doing some form of strength training or some sort of cardiovascular. So if they're already going back to that, we try to tie that into what I'm doing, and then the stuff that we give them is more accessory work or warm up, and we try to put that together, because you know, life doesn't give us the luxury of doing 3 hours of exercises a day. So we have that conversation at the end. It's a great question and a common question I get. But the reality is, at some point you want to keep pushing, and you want to keep things varied. So you don't want to just do the same thing for 9 months. So sometimes we have check-ins with people to say, let's switch it up a little bit, or here's what I would do. Brother, yeah.
Have you done that caping and crowning, that 1 out of 20, the gentleman mentioned that.
Yep.
Other people that have full flex devices put in that L3, L4, L5.
Yep.
Doctor wants to put an electrical implant in there.
Yeah.
So you have two people who come to see you with those limitations, work with them, and they found, whoa, awesome.
Mm-hmm.
How come I didn't hear this from like Dr. Yazbach, physical therapist there?
Yes. So I would say that that's a mixed bag, because it depends on if the person went through what I would consider a really official course of conservative care beforehand. And official to me would mean that they were with somebody who were looking at some of the things that we tend to look at. So I don't claim to be better than anybody else in terms of a practitioner, but I think our model really is a little bit more of uncovering all the stones that need to be uncovered conservatively before we're going to go down the route of MRI injection surgery. If somebody's done that, I am a little less optimistic for them that post-surgery that, you know, we're all of a sudden going to be this miracle worker or come along and help them. But there are a lot of people, unfortunately, that skipped the conservative care part. And so when they skipped that part and went right down I went from imaging to injections to surgeries, then they come in here, they're still like, I wish this would have been a part of it beforehand. I wish I knew this was there. Yeah. Other question. Come on, put them on the hot seat. Yes.
What was the length of time? Normal to maybe great.
I would say,
Oh, go ahead.
probably a week, where I was walking out the door going, oh, I feel hope. I feel good about going home and continuing with the exercises. And then it improved each and every time. And I would probably say about almost 3 weeks before I said, okay, I can skip out of here. I feel terrific.
Kind of bad on the timeline, but thank you,
We-
Jack.
It's hard to remember.
I'm not, because
Good. Okay. Good.
I remember this stuff.
Here for it.
You were doing really well, and then you had kind of like almost like a new setback.
Yeah, it was a different.
It's a different setback, same location, but then bigger setback. So it was almost like we maybe went a little too fast too soon, and then had a little.
Yeah, that might have been my fault though. Get after it too fast.
I feel like that was me too, where I came in initially, and when the first consultation, I actually said, like, I don't know, something kind of tweaked in my back earlier in the day, and I'm feeling pretty good, and like all of my testing and stuff was testing really good, and you're like, oh, I think this is going to be pretty. And then of course did some dry needling, felt great, and then went back to the gym, and then I really tweaked it to the point where so
No,
then,
they know what they're doing over there.
but yeah, when I re-hurt my back, it was so bad that I remember getting up on a Saturday morning and literally rolling out of bed onto the floor and crawling to the bathroom to draw a bath to try and just relieve some of the pain. So then I came back in. I had a meeting already scheduled, and I came back in, and I'm like, yeah, I did something. But then after that, then working once a week to he'd give me exercises, and each week I would improve and then take another step. So I'd say it was probably 4 to 5 weeks maybe, where just every week I would see improvement. It was immediate, like I said, the WD-40 for the back, just with some of those exercises to help get the mobility together. But yeah, I would say after probably about 5 weeks, I felt 95%.
How long ago was this? When did this all happen?
Mine was this year.
This year.
January? February? January? It was the second time, but
So
worse
you
this
guys are all
time.
recent.
Yeah, I feel
It's
like-
just
Yeah,
recent.
recent.
Yeah.
Okay. And you're fine. I mean, pretty much 100%.
Yeah.
No pain.
I mean, if I have a hard workout, I'll still feel a little bit of stiffness. But like I said to Eric, also getting older. I might just be might be the new normal for some of that. But usually it's a couple minutes and it's worked itself out. And I'm feeling good.
Very good. Thank you. One more round of applause for our superheroes. Okay, so you guys want to stay up here by me? You can sit.
Where do you want?
We're almost done. So wherever you want to be. So I will stick around for Q&A. Either. Oh my gosh,
She's on falling to pieces.
that's not that expensive tiara I got, is it?
Earring back.
The back of the ear.
We'll look for it
Yeah.
afterwards.
So hopefully tonight we get a little bit of an idea. Like I said, if anybody has more anatomy based and kind of specific things about their specific situation, I'm more than happy to talk about it. I just did not want to sit here and blab to you for an hour about L4, L5, sacroiliac, gluteus medius, et cetera, et cetera. I think it's important to understand the why behind this stuff before we get into the what. And hopefully get a little bit of insight from me in 16 years of doing this now, and getting some understanding from our current and past patients about how their process went. And I would just invite you, based on tonight, based off of what the other individuals say, I'd invite you to join us and start your journey with us. So for tonight, we have a couple different things. So you can grab a Health Boost voucher, which is basically that introductory session where there's no obligation, no cost. I'm not going to give you a crazy hard sales pitch, and you can take that and use it whenever. If you do book that session tonight, I will give you $50 credit towards future clinic use, which can be used for massage, can be used with me, can be used for performance training, any of that stuff. So basically, I'm going to pay you to give you solutions to your problem if you want to take action on tonight. And then the only other thing that I want to say is just thank you very much for taking time out. I love this number of people, so that hopefully we can get a little bit more engaged and dynamic. And it means a lot to me that people are willing to come out and listen and hear stories and then have individuals share their stories. I really appreciate that. And please, please, please preach to other people about what we talked about tonight. I'm not starting the Church of Motus quite yet, but it really, really helps. If you've had a good experience or you've had success here, people are usually willing to tell one person. If they've had a bad experience, they'll tell 20. So I just ask you to really try to share this with other people, and anything that you learned tonight. I can give you the slides. Not that there was a ton of information on them. There are more guides, but I can give you the slides about tonight. And then I'm more than happy now or just after individually, I'll stick around and answer any questions that you might have. But otherwise, stop by Becky and she can help you get scheduled if you want to do that. There's also plenty of food. Becky worked really, really hard on that food. So you can have 2 servings if you can say charcuterie correct. So thank you very much, everybody, for your time, and I'll hang around to talk.